Hi, everyone. Thank you so much for being here with us today. I'm Joyce Griggs from United States of Healthcare, and I'm joined today by my co-host, Becca Radford from Journal My Health. And as you know, we're always here to bring you more information, tips, and tools to be the very best advocate you can be for yourself when it comes to your healthcare. And I'm delighted today that we are joined by Dr. Alan Feren, who has over 50 years of experience on both sides of the stethoscope. And he's going to talk to us today about partnership with your healthcare professional and what does that look like. And I don't know if any of us have thought about it, but being in partnership with your doctor is really critical to getting the very best health and care that you can get. And there are many benefits to forming this partnership. And so how do you do it? So we're here to talk with Dr. Feren about how we can go about doing that. He is an expert in clinical content development and has a long career in patient advocacy. He also continues his advocacy through his program, My Personal Advocate, and we really encourage you to, the links are provided in the description here of the video, and please go and check out My Personal Advocate and what Dr. Feren has to offer. So I'd like to begin a little bit, Dr. Feren, if you would, by telling us, so what is partnership in a relationship with our doctor or a nurse practitioner, if we see a nurse practitioner, and why is it so important?
As you mentioned, Joyce, first, thank you both for allowing me to spend this time with your audience. It's a pleasure. Partnership is something that I have thought about a great deal and initiated partnership with my patients dating back to even when I was a resident in surgery. To be a partner is more than being a passive individual who is listening to your doctor and saying, yes, doctor, yes, doctor, yes, doctor. A partner is someone who really is very active in their care, who is willing to ask the tough questions about what do I have, why do I have it, push aside the doctor speak that makes it very difficult for people to understand exactly what's going on with them. They are also people who will follow and understand their treatment plan. We know from the data, it's clear that people who are partners in their care with their physicians have higher satisfaction rates, they follow their treatment plans, and they have better clinical outcomes. And this is really what used to be called patient-focused care. In the past, people spoke about the doctor-patient relationship. I'm not a big fan of relationships. Relationships mean there's no responsibility that you have. And I would tell my patients, look, this is your body. It's the only one you get, as far as I'm aware, this time around. So you better take care of it. And the only way to take care of it is to really be a partner with your physician.
So there are tremendous benefits at the end of the day. What you're really talking about is an activated patient.
Yeah, so we throw around a lot of terms. We talk about patient engagement. We talk about patient activation. When we look at being fully empowered and being an advocate for yourself, for your care, you are activated because you are willing and able to help manage your care in a relationship or partnership with your physician. Engagement is more of an overall umbrella. So an engaged patient is an activated patient and one who is, in fact, a partner in their care. And again, the focus really is on the fact that you have a responsibility. And that responsibility is to, accurately report, accurately listen, accurately understand. There's homework involved, and we'll talk about that later, I'm sure, to really be a partner.
Actually, I think this is a good time to get into that now. So one of my questions for you was, what does this activated patient look like? What do they do? So if you could get into a little bit of that homework or what you see, what actions you see this activated person taking.
Yeah, the first thing that pops up in my mind is stay away from Dr. Google. That's a major problem. The homework that I cite when you are an activated patient and fully engaged in your care is looking at credible resources. And the best resources are those that are really easy to find on the web. It's the Cleveland Clinic, it's the Mayo Clinic. You can go to the National Institute of Health, NIH, most of the government health websites, the immunization websites, which we're probably all familiar with because of COVID, constantly accessing those. Yeah. Those are good starting places. People who are non-scientific, non-medical, understanding the peer-reviewed literature, very, very difficult. My experience with WebMD has been very positive. I think that they write in a way that people can understand. They move off of the doctor speak. So those are areas that I think are worthwhile to look at. Mm-hmm. An activated patient is also one who will ask questions until they understand. And this gets us back to, I think, a prior issue, which is how do I partner with my doctor? How do I find someone that's willing to partner with me? Well, first of all, both parties have to be open to the concept. Some doctors will say, yeah, I want to partner with you. But it's like the old saying goes, actions speak louder than words. Yeah. If you are in a situation where you're talking to your doctor and their eyes get glazed over, or they are interrupting you quite frequently, that's probably not the best fit for being a partner.
So what are some of the other characteristics, Dr. Feren, that we should look for when we're looking for that, the physician or nurse practitioner, whoever it is we're seeing as our healthcare professional? What are some of those characteristics we need to be looking for?
After you have that open and honest conversation with your doctor about, are you willing to partner? And they say, well, what do you mean by being a partner? And what I mean by being a partner is someone who is going to share in the decision-making with me. So that's the shared decision-making that we can speak about in a little bit. Yeah. Also, if a doctor starts interrupting you, or you see that you become visibly agitated when not necessarily challenging, but offering your opinion or saying, well, what about this as an alternative, then you know that that's someone who really probably in the long run is not going to be your best partner.
Yeah. Yeah, and that's a great point. We have a couple of blog posts on United States of Healthcare about how to be your own health advocate, or what does self-advocacy mean. And we do talk about that, exactly that, like, always bring your questions, always tell your doctor, whoever your healthcare professional is, tell them everything, and let them help you, discern like what are the priorities. But if they're not interested in hearing from you, then that is a red flag.
You still have to do your homework. People can come in with a laundry list of 8 and 10 things,
about that,
and they have 10 to 15 minutes to identify what are the key issues. Yes. So that's part of the homework, is to prioritize and organize. But if your doctor gets glazed over when you start talking about a list of 4 or 5 things and say, we only have time to do one thing today, that's probably not someone who's going to be compassionate and interested in being a partner with you.
Yeah. I think so. This might be an interesting exercise. So could you actually walk us through like what a typical office visit would look like that has a healthy partnership between a patient and the doctor? What does that look like to you?
Well, I think that there is some prep work first that will be an enabler for a good partnership and a good office visit. I usually tell patients to arrive 10 minutes early, 15 minutes early, although that typically now, with at least in my experience, I'm always getting these reminders to show up 10 or 15 minutes. Usually those who are involved with electronic medical records, EMRs, you are able to do these e-sign-ins in advance. So they go over a lot of the different things of your condition, your health insurance, and so forth. So that's helpful. But it's better to be early than to be late. There's nothing worse for a physician who typically is going to run late anyhow, but in the event that they are running early, to wait for their patients. So that's not a good start. The second thing is to, again, emphasize, do your homework, make sure that you have the information that you need along with your questions associated with it, because that facilitates a good interchange with your doctor. It's helpful to have notes in between your visits or to journal if you've got a new onset of an illness. You want to be as accurate as you can about your signs and symptoms when they occur. Are they all the time? Are they part-time? All those kinds of things are very helpful for your physician. You want to, in some instances, take control over the conversation if you can. I think that leads to a better outcome. In other words, your physician will give you some information. You ask the questions until you understand. Very key. Be there with a companion, an advocate, if at all possible. But if not, record, ask, but of course, ask permission. With all of this, I think it's important for there to be some mutual respect in attempting to have this best experience that we're talking about. And it's important for you to be honest and open, so that if they're asking you if you're smoking, if you're taking drugs, if you're taking supplements, but you don't tell them, doctors need to know this information for them to really do their job. And so at the end, it's not active listening, but to summarize what it is that you've actually heard and what's your understanding of the treatment plan. When the treatment plan is finally agreed upon, make sure that you can follow that treatment plan. And if you're not able to, a good physician partner will spend a little extra time trying to understand and identify what are the obstacles that prevent you. So sometimes it's cost, sometimes it's transportation. So there are lots of other things that are important in terms of maintaining and managing your care and following a treatment plan. Sometimes it can be a drug that he or she wants you to take 3 times a day. Well, maybe that's just not comfortable for you. I myself find I need a reminder. I take a drug twice a day, and I use either my phone or my watch to notify me that I need to take it, because as the day goes on, I'm going to forget for sure. And so, adherence to that treatment plan is important. So an interesting study that I was just looking at when I was preparing for this was in the Annals of Internal Medicine in 2018. Physicians who led off the conversation with, how can I help you today? Or what brings you in here today? Found that there was very little interruption by the physician when the patient is trying to respond. But if you start off with all your symptoms and signs, the doctor typically will interrupt you within 11 seconds. So you know that that's not going to go very well in terms of a partnership.
Yeah, you'll know right away. I want to go back to what you were saying about asking questions, because we know, I mean, I think you cited it today. We know that anybody who asks questions gets better healthcare. There's data that prove that out. But sometimes, we're in the office, the doctor is telling us something, maybe something new, or reiterating something we've heard before. And then they say, do you have any questions? And the mind goes blank. There's got to be and I've said to people, then just ask them can you just repeat that? Or what other options do I have? Are there any other sort of go-to questions that we can put into our back pocket that could work in a lot of situations?
Sometimes doing that kind of post-mortem on your evaluation or examination, and restating, well, this is my understanding, and then ask, are there any alternatives? At least it gives you a spacer, if you will, to see. But that's the reason why I suggest recording, because those questions are going to come up.
Yeah.
It's a very time constricted appointment that most people will have, unless you're involved with concierge medicine, which, as everyone knows, is quite expensive. Doctors really luxuriate in the time that they have, as well as patients do. But in the 10 or 15-minute confines of a brief office visit, it's very difficult for you to think about what you've just heard. That's why some of the preparation and writing, as you've mentioned, questions down before you come in, those are some good tips. But you're going to be on your heels when you hear something new and haven't been able to prepare for it. Having that recording will help you, and then you can get back to the office. With electronic medical records, it's really, I think, a good opportunity for patients to continue. That's part of the partnership, knowing that the message to your doctor's office or to your doctor won't be answered within 2 to 3, usually typically 2 to 3 days, but sometimes longer. But from that recording, you can identify that question and send it back to them, and they'll get back to you.
Yes, yes. No, very, very important. And so then we shouldn't be sheepish about asking our healthcare professionals if we may record. I mean, they may say no, but they may say yes. And then we have a great recording that we can, and there's so many tools now that we can use to transcribe these recordings too. And then family members, right? Family members who are interested in our care can also listen and help us to figure out what we just heard.
One of the pluses of the electronic medical records is the so-called AVS, the after visit summary. These are generated typically and required by law, particularly for Medicare. And so make sure that you go on your patient portal, if you have access to electronic medical record, learn to be comfortable with it, learn to look at your laboratory data, look at the interpretations of your x-rays, your CTs, your MRIs, so that you have a good understanding and track and follow. What's nice is you can trend. So if you've got a normal lab that later on becomes abnormal, you can see the trend line. The same is true with the x-rays. And sometimes it's worthwhile to print out those copies. And so when you are going from your primary care to a specialist who may not have seen those particular studies and the results, they'll say, well, I have to get back to you on that. You have the information, and they can scan it or they can read it with you while you're in the office. It makes the visit much more efficient time-wise.
Those are such great tips, and this is like chock full of tips. I know that people are going to listen to this recording more than once because these are really important tips. And I just want to kind of go back to a little bit on the patient portal. If you don't already, just to our audience, if you're not already using the patient portal that your healthcare professionals are providing to you, then have somebody help you if you're not really sure how to use it, because there is a wealth of information there, and also a way of communicating with the healthcare team that you have. So it's really a very important tool that we have now as patients, that, before it was very difficult to get through to the doctor, because doctors and nurse practitioners and all of the healthcare teams are very busy. And so it's hard to get on the phone. Now we can at least have a dialogue, which I think is critical to our care.
And make sure that when you use this, it's not for diagnosis and treatment. And now I've noticed on my EMR, which is Epic, and that's one of the larger, more common electronic medical records today, they have something on there that says, this is the message. If your doctor or your healthcare professional indicates that this is more of an office visit, then you'll be billed for it.
Yeah.
So, and clearly, it's not for emergency care. If you've got chest pain, if you've got bleeding, if you've got something that requires urgent care,
Yes.
the electronic medical record is not a place for
That's right.
those that information.
But it's a great place for follow-up questions or to verify that you understand the
Absolutely. I
plan.
heartily
You
agree.
see
And
those
then-
trends
and
over
then-
time.
Exactly, trends over time, and you can just educating yourself on your own health data. And then, of course, if another appointment is needed, I've said this to people many times, make a follow-up appointment. Yes, it may not be covered by insurance, but find out how much it costs. Sometimes you will be surprised that the doctor visit is not as expensive as you think it's going to be. And so I do also encourage that as well when needed. Wow, it's great. So just before Becca closes us up, any other tips or burning issues that you want to give to our audience before we close?
Well, I think there are two points that I'd like to make. Number one, most doctors want to do the right thing for their patients.
Yeah.
They're not always right or correct, but I think that they really are trying to do the best they can.
Yeah.
So I think it's important for patients to recognize that. I think there's a lot of frustration. All of us, when we have illness, we feel out of control. And I think becoming a partner helps you gain back some of that control, or feel like you have a modicum, if you will, of control when you're trying to manage your care. I think all of us feel better when we've got a problem. If we take baby steps towards solving that problem, we're going to feel better. And I think that's absolutely relevant for healthcare as well.
Mm-hmm. Yeah.
And I think the last thing is, you are the expert for your body, irrespective of not having a medical degree. You are the one that knows best. And so if something's not working for you, if something doesn't feel right, it's very important to let your doctor know. It could be taking a medicine. It could be starting a physical therapy program and for back problems, and it's hurting your back, but they say you need to do 10 of these and 15 of those. Don't do them if they hurt. It's just very, very important.
Mm-hmm.
So be an accurate reporter, be an accurate listener. Communication is two-way when you are truly a partner. And the two-way conversation, remember that listening is over 50% of communication. So it's not this.
Mm-hmm. Wow.
Dr. Feren, what an excellent note to end this episode on. Thank you so much for all the tips, all the wisdom, and for giving us a little bit of your time. Again, for our listeners, you can learn more about Dr. Feren with his work with My Personal Advocate. We'll have all the show links in the description, so you can click around and explore more. And thank you again, Dr. Feren.
My pleasure.
Thank you so much.